A couple of you have asked about prioritization questions, and those are definitely a hot topic. I'm going to show you in a little while how you can get to our prioritization cheat sheet. But again, just like any of your weak areas, if you wanted to come in here and you're like, I know prioritization questions are tough for me, I can make a whole test of just prioritization questions. And let's see, I'm going to warm you guys up by just asking you a question real quick since we're already here. The nurse is notified of the following client situations. The nurse should first assess, 1, a client with influenza who's got this fever, a client with pancreatitis who has abdominal guarding with palpation, a client with tuberculosis who's got blood-tinged sputum, or a client following a traumatic crush injury who has dark brown urine in their catheter bag. And my first tip for answering prioritization questions for you would be to eliminate anything that is an expected abnormal finding. Some abnormal findings are expected. Like, is it expected for someone to have a fever with the flu? Yes. It might not be expected for them to have respiratory distress, right? Or an oxygen saturation of 80, but a fever is expected. So we can cross this one out. Pancreatitis, abdominal guarding with palpation, that's expected. If they were maybe vomiting profusely without stopping, that's going to be a risk for dehydration and would need me to do something, but just abdominal guarding with palpation, that's expected. Then client with tuberculosis who's reporting blood-tinged sputum. That's expected. You guys get the gist now. And then traumatic crush injury with dark brown urine in their catheter bag. No, if it said traumatic crush injury with pain or something like this, then that would be expected. But dark brown urine in the catheter bag, this is a warning sign of myoglobinuria, which happens with rhabdomyolysis. So they've got a crush injury, their muscles start to die and release myoglobin, which can damage the kidneys. That's my first tip for prioritization to answer your question that came up was eliminate your expected abnormals. And I'm going to go ahead and show you guys now within our product, if you guys want to review specific topics. So in this case, if we want to review just prioritization, you can come in here and take a look at our cheat sheets and our management of care cheat sheets. Here we have our prioritization cheat sheet with our proprietary prioritization pyramid, and that is our first step, is we eliminate stable and chronic issues. So those were all expected abnormals, stable chronic issues. We were able to quickly eliminate them. Lenore says, do you need to pass all of them in order to pass the NCLEX? So Lenore, I'm going to show you here our readiness exam page. So you don't have to pass all of the readiness exams with a very high chance of passing. Again, you just want to see yourself progressing as you want to see yourself improving as you progress and study more and practice more. At the end, if you still have some time left, you can even reset the ones that you've already taken and see if you score higher than you did before. So hopefully that's what you mean, is you need to pass all of these. All right. Chua says, I don't mind doing questions, but how do you go back and do rationales? Do you just reread it or write it down? So Chua, that is a great question. And I would say it kind of depends on your level of comfort with that content. So what we have done for you is we actually break down the full explanation. So we show you the correct and the incorrect answers. So yes, whenever you're answering this question, we've got explanations on the correct answers and each of the incorrect ones. But say you knew it. Say you were answering this question and you're really certain that you just knew it, you didn't need to read it, you just wanted to kind of brush up on your knowledge. We have our key takeaways here where you can get kind of very quickly, what was I supposed to remember, or what key things was I supposed to take away from this question and learn there. You can also tag questions. So as you're answering them, if you want to say you get it right, it's going to be tagged as mastered. But if you feel like I guessed on this and I know I guessed on this and I need to come back and review it, you can tag it as reviewing, and then that is going to show up in your bank of questions you need to review. And then you could take more time to actually pass through and read the explanation in more detail.